Good morning. My name is Karen Teitelbaum, and as President and CEO of Sinai Health System, it's my pleasure to welcome you today. Governor Quinn and honored guests, on behalf of the members of Sinai Health System's Board of Directors and my fellow caregivers, we're pleased to be with you today for the signing of a bill that has such personal significance to Sinai Health System. House Bill 5412 recognizes the importance of community health workers as key members in improving the health of our community as part of the healthcare team. Sinai community health workers are now and have long been on the front line of reducing healthcare disparities in breast health, diabetes, and asthma in the neighborhoods we serve. Our community health workers really make a difference in lives, and they are making lives better. To all of the individuals, Robin Gabel, all the other bill sponsors, and the organizations who have worked so hard to make this bill happen, and I'd be remiss if I didn't say, and in dear memory of Dr. Steve Whitman, I want to thank you all, and to those who champion for our urban hospitals, our patients, and our communities, and especially you, Governor Quinn. We extend grateful thanks for your work and for holding this historic moment here at Sinai. Thank you so much.
I'm really glad to be here. You know, Mount Sinai is an institution that Illinois treasures, as well as Holy Cross Hospital that has joined the Mount Sinai family. We're all in this together. And I think that the law that we're going to sign today is very, very historic indeed. We understand how important it is to have community health workers that really serve as a bridge between our healthcare professionals, our doctors, our nurses, all our researchers, and the community at large. And it's important, all the research has shown, and we put together a task force to look at this issue that came up with this law. And I do want to thank all of those who were involved in getting this law passed through the legislature. Robin Gabel, sorry, Robin is, where are you, Robin? Right over there. Sorry about that. But Robin Gabel, I think every time I saw her would say community health worker. And it's important to have an advocate, a zealous advocate like Robin, who understood that this is indispensable for us to have health care that reaches everyone. Access is very, very important to make sure that everyone in the community knows what their opportunities are. And as we just heard from Karen, how important this is to deal with ailments, whether it be breast cancer or dealing with asthma or diabetes or high blood pressure. Many of these particular challenges, health challenges, we have to have people in the community working with folks from the community about taking their medications in a proper way and not forgetting, making sure they're aware of some of the things maybe in their house that could be causing problems, such as mold causing problems for asthma or whatever the case might be. That's what community health workers are. They're on the front line and they're doing a great job. We want to make sure our whole state embraces this vocation, and it is an important vocation. It's not a job. It's not even a career. It is a special mission to make people healthy. And I think that's really important. We owe a debt of gratitude to our president, President Barack Obama, who was unwavering in saying when he became president, was elected, and took the oath of office, we're going to do something about making health care better in America. And he has. The Affordable Care Act is in our state, which we passed the laws thanks to Robin. I know Chris Welch is here, Representative Welch, and Senator Jackie Collins. We had to, with the House and the Senate, pass a law making Illinois eligible for money from Washington under the Affordable Care Act. And this began late last year, and so far more than 600,000 people in Illinois, men and women, boys and girls, 600,000 people have received health coverage under the Affordable Care Act. This is really a great achievement. And we're just getting started. That's part of what our community health workers are all about. They're going to help folks navigate through the system, learn about the system, answer questions. I was on a panel not too long ago with a big insurance company, and they said they had to add workers to their call center, because some of the new folks who have just gotten health coverage, maybe for the first time in their whole life, well, they're not all familiar with some of the terms and the language of the policies and so on. And one person called up and said, "What's a refill? What's a refill on a prescription?" And isn't this important that people who maybe get that prescription to take care of their blood pressure so it doesn't go to 150 or higher, that person is not going to have the kind of severe problems that can come from high blood pressure. So that's why we have to take the wonders of medicine in this great hospital. Holy Cross, an institution on the southwest side, right here, Mount Sinai, has been here for about 100 years or so, a century of service. And so many people work here, too. I want to make sure that we know that all the folks who work at our hospitals, they really are key employees for the whole state of Illinois. We want to be a healthy state. We want to have a wellness approach. This is what the Affordable Care Act is about. That's what community health workers are all about. They're on the front line interacting with people from their community, and sometimes the language of a particular person that may not understand English so well, but understands Spanish, and telling them in language that they understand what they need to do to be healthy. I think this is a mission of a lifetime. And not that long ago, 13 years ago, I was right near here. Matter of fact, I walked by here with my doctor, Quentin Young, Dr. Quentin Young, and Dr. Young and his organization, Health and Medicine, was involved in getting this law passed. But Dr. Young and I got on a bridge above the Mississippi River in Rock Island. It's called the Centennial Bridge. And we're right there at the state line. And we walked all the way to Chicago and Lake Michigan on behalf of decent health care for everybody. Everybody in and nobody left out. So really, this is what this mission is all about. The community health worker is a key person in the equation of reaching out and grabbing the community and making sure people know what the opportunities are and what good health can be. And so I really am excited about this bill, which will become law today. I do want to thank the Sinai Urban Health Institute for their commitment. It was mentioned about Dr. Steve Whitman. We really treasure his memory. He was a zealous advocate for community health, and thank him very, very much for what he did on behalf of all of us at the Sinai Urban Health Institute. I also want to thank Wendy Hernandez, who's director of Health Connect 1. It's very important to have that. The UIC School of Public Health. How about the UIC Public School of Health? I went to their graduation a couple of years ago. You know, the advances of American life expectancy over the last century have come from many, many public health measures. And that's what community health workers are all about. They're on the front line for public health. We're going to hear from our Dr. Hasbrouck in a minute about how important public health is. So this is part of our mission. We also want to thank the Chicago Community Health Workers Local Network for helping get it done. How about Ever Thrive Illinois? We believe in that too, I'll tell you that. Well, I've said enough. We have somebody who has put this issue front and center, who's made this a cause of a lifetime, who understand how important this is to helping all of our people become healthy and well, and that's Representative Robin Gabel. Take it from there, Robin.
Thank you so much, Governor. It's clear that you truly understand this issue and that you understand it as well as I do. So thank you so much for having this big event today to really celebrate this bill signing. This bill has been a long time coming. For years, people at Mount Sinai, people at Health Connect 1, folks at Levio Medical Center have been training community health workers. And the community health workers, some could get jobs and some couldn't. They had kind of like an unofficial status. But they were critical to the health of the community. I recently saw research that showed that the doulas, the community health workers who help women who are pregnant, have better outcomes for the clients, that they have fewer C-sections. Women know how to have babies. We don't all need C-sections. They have an improved rate of breastfeeding. Breast milk is what babies should be drinking, not cow's milk. They're not calves, they're babies. So The role that doulas and community health workers have played is so critically important. And this bill helps two groups of people. First, it helps the community health workers themselves. These are women from the community who have worked very hard. This, as the governor said, this is a vocation for them, not just a career, but it also should be a career. And they should be able to make money doing the work that they love. And this will give them an opportunity to do that. This will give them a certification process and a career path for them to better themselves, better their families, as they provide much needed services to the community. And the second group that will benefit so much from this is the community members themselves. Now, we all know that medical lease is a language in and of itself, that a lot of people don't understand it. The example just given was refills. Who knew what refill meant? So the role of the community health worker is really to translate medical ease to the common person, so they can understand what the directions from their doctors were and what they need to do to be as healthy as possible. So I really applaud the governor for doing this. I so appreciate it. And I really want to thank all the organizations who have worked so very hard for so many years to make this happen. So we're going to be hearing from advocates, and we're going to be hearing from a community health worker, and they can tell their story much better than I can tell it for them. So thank you all again for coming today and for signing this.
I really want to thank Robin for her tremendous, tireless advocacy on this cause. And I want to bring forward now our Director of Public Health, Dr. Lamar Hasbrouck. I mentioned how important public health is to advancing life expectancy in our state and our country. Americans have a longer life expectancy today than 100 years ago because of all the good things we've done in public health. And this is one of them we're adding to today. So take it from there, Doctor. Come on forward.
Thank you, Governor, and good morning. You know, Governor, under your direction, the Department of Public Health led efforts to study the healthcare workforce issue and the needs across the state probably some 18 months ago or so. And this work, which was done in collaboration with other sister agencies and external policy experts such as Health Medicine Policy Research Group, resulted in a report that described what we know as a sobering reality. And that reality is that there is a real shortage of healthcare workforce in our state. There is a distribution problem. We know there's pockets across the state that don't have good access to qualified health workers. And most importantly, it documented the need for creative solutions to meet the demand of the growing number of health consumers that we've added as a result of Obamacare. So today's bill signing is really an important step towards ensuring that the supply really meets the demand by formally recognizing not only the role but also the value of community health workers. These are unsung heroes that go by any number of names, promotoras or doulas or facilitators, but they basically link residents to the services they need. They help to reduce disparities in doing so, and then ultimately they support everyday people in their quest to live healthy and productive lives right in the context of their communities. We know that the arc of wellness bends really at the community level, not in the facility in the hospital when you're sick, but what happens in the community really determines how healthy or how sick that communities are. So just in short, I want to say again that I am proud to be a part of an administration, proud to be a part of this larger team that continues to find ways to expand resources, human resources and other resources, to meet the needs of all Illinoisans. I want to thank the advocates behind me. I want to thank Representative Gabel, a tireless champion of public health here, and the other legislators. And again, Governor Quinn, I want to thank you.
Okay, thank you. Well, I think what Dr. Hasbrouck said we need to take to heart, especially the issue on disparities. We do not want a two-tier system in Illinois or America. We want everybody to have good health. And that means community health workers. And somebody who can talk about being a community health worker is with us today. Kim Artis is with Sinai System, community health worker. And why don't you come forward here, Kim, and take it from there, okay?
Good morning, everyone. My name is Kim Artis. I'm a community health worker with Sinai Urban Health Institute's asthma program. I'm here to speak about the wonderful job that I have. And again, as the governor already said, it's not a job, it's a passion. It's a passion that you have and that the people that you serve feel. And the whole premise of a community health worker is to be a part of that community. I live in those communities that I serve and I help, and I see so much every day. And when you develop a trust between you and that client, you are able to see a whole picture that the healthcare system doesn't see. And I had an opportunity to assist one of my clients with asthma. And one of the things that was keeping her sick that she had no idea was the mold in her carpet, and how she was a bit depressed about that as well. And she didn't realize it. Is this what's making me sick? So I was able to advocate for her in that avenue and to assist with getting that carpet removed. And once the new flooring was down, she looked at me with tears in her eyes and she said, "Kim, I realized I was depressed and dealing with asthma. And I didn't know that until this actual carpeting was out of my house. And now there's a whole different air in my home. I feel better. I'm looking better. And that was worth more to me than any paycheck could give. But I'm very glad to be able to have that relationship with the people that I serve in the community that I live and to make a difference. My job is not really work. It's a love. It's a calling. And I'll do it as long as my clients will let me do it. And I thank you for this opportunity this morning.
All right. Now here's a healthcare hero right here. Very good. Well, very, very good. We understand now how important a community health worker is to a person who suffering from asthma, and getting proper kind of guidance and advice change your life. And that's what we're here to do, right? Change lives, make them better. And now I want to bring forward Leticia Boughton, who is the network coordinator for the Chicago Community Health Workers Local Network. We're going to organize, and we're going to keep on moving forward. Okay, take it from there.
Such an awesome occasion for community health workers across Illinois. I am the network coordinator for the Chicago Community Health Workers Local Network under the fiscal leadership of Health Connect One. And we have been doing this thing since 2003, trying to get community health workers' voice to matter and get them to feel valuable and feel that their work makes a difference. So since 2003, to have this thing come to life and fruition today, the baby is born. Hallelujah. Thank you, Dr. Quinn. And so we didn't do this by ourselves. It took some very strategic partnerships, the passion and the efforts of all community health workers across the state of Illinois to get this thing born and into fruition. So partnerships with organizations like the Chicago Family Health Center, HCI, we've already mentioned Health and Medicine, Health Connect One, Allevio, and other organizations that understand and get it, Sinai Urban Health Institute. So this is very, very much appreciated, but the work is not done. We still have much more work to do. We have to bridge those gaps between the communities and our healthcare and social service systems, because community health workers, I like to call them the social determinants of health agents. They not only are concerned with health, but they are concerned about education. They are concerned about justice in different areas. And that is what is most important. So I am grateful for today. I thank everyone that has been a part of this effort, and just know that there are much more work to do, although this legislation does provide workforce development and education and training opportunities. But most importantly, it just provides that awareness of who community health workers are, the value that they bring to any healthcare social service delivery system, and just the importance of the holistic approach to health that this state of Illinois needs. So thank you all so much. There's still work to do. We're still looking for more collaborations and partnerships to move the community health worker workforce forward. So thank you, and I look forward to you all getting involved. Thank you.
Well, Leticia said it very well. It's a holistic approach to good health. Everybody in, nobody left out. I'm going to go sign this into law right now. Everybody go. Okay, we're on this side. You guys share. Pass them around, okay? All right. Yes, keep going here. Here we go. Jackie. Yeah. Okay. Nice. Barbara. There, you good? Okay, well, we've just made history right here. Let's step over here in case there's any questions real quick. All right, everybody, if there's a question or two, we'll answer that. This is, I really feel many occasions are called historic. This one actually is. This is a really special day. Any questions from our friends?
Governor, what do you make of the fact that your opponent, Bruce Rauner, has he hasn't been available so much media lately, especially when it comes to the issue of tax inversion, which I know you've talked about.
Well, he's clearly hiding on that issue. I'm with President Obama. The President said it for our whole country, I think, last Friday. We can't have big corporations that are doing very well with profits, who have consumers right here in America, especially here in Illinois, deciding that they want to renounce their American citizenship, their U.S. citizenship, and go to some foreign country and try and get lower taxes there to the detriment of everyday people right here in Illinois and in the USA. This is a fundamental issue. The President said those are corporate deserters, and I'm with the President, and I know my opponent thinks that's okay. He said so on TV the other night. And he has a lot of explaining to do, because we need to have everybody in when it comes to paying their fair share of taxes, and that includes those big corporations that are trying to shift the burden on the everyday people. We got to pay for education, we got to pay for health care, we got to pay for public safety, we got to pay for our national defense, and everybody's part of this. And these big corporate big shots that are moving their companies overseas as a way to avoid paying their fair share of taxes, that's an issue that hurts the people of Illinois and it hurts the people of America. And I am with the President of the United States, Barack Obama. We got to put a stop to this. If Bruce Rauner wants to let these corporations run away from their fair share, he's just plain wrong.
Any comment on his plan to release his federal income tax return or some part of it on October 15th?
Well, he has already filed his income taxes for a couple previous years, and the schedules are available, but he's hiding those because I think we know he's been jumping through a lot of loopholes that lower his taxes, and I think we need to know exactly what those loopholes are. If you want to run for governor of Illinois, I think you owe it to the people to do what I have done. Every year I've been in public life, I disclose my income tax, And I think Mr. Rauner should do the same, including his schedules. That's what the people demand. And I think all these loopholes that corporations are using and some big super wealthy people are using to hide money overseas, stash it away from taxation. People here, you can't make up your own rules when it comes to taxes. You pay your fair share, and that rule should apply to Bruce Rauner and all these corporations seeking to flee America. You know, when I heard about this inversion business, you know, it boils your blood. These companies are making a lot of money off American consumers. They're getting our law enforcement protection and everything else that comes with being a citizen of our country, and then they'll renounce their citizenship to go to another country. I don't know how in the world Bruce Rauner can defend that. He did the other night on TV, and I think he's wrong. Okay? Any other questions on community health workers? Okay, well, if you don't, we're going to make sure this is a mighty wave. This is just the beginning. We heard from Leticia. We want to make sure we have lots of people with this vocation that are going to make lives better to folks who need a helping hand. Community health workers, the sky's the limit. Thank you very much.
Yeah.